Military and veterans coverage.
Healthcare coverage for military members, veterans, and their families is distinct from employer-sponsored or marketplace coverage. While also funded by the U.S. government, it is separate from Medicare and Medicaid. The type of military coverage available, how it works, and at what cost depends on service history, duty status, relationship to service or former service member, age, and sometimes other factors, such as income or disability. Two main systems provide coverage and care: TRICARE and the U.S. Department of Veterans Affairs, or the VA. Some individuals and families may qualify for only TRICARE, only VA, or both, depending on their circumstances. TRICARE is the healthcare program for active duty service members, National Guard and Reserve members, military retirees, and their families. Active duty service members and their families receive care at military treatment facilities or through TRICARE network providers. Most do not pay premiums or out-of-pocket costs for covered services. Retirees and their family members can choose from several TRICARE plan options. Cost and provider flexibility vary by plan. TRICARE Prime works much like an HMO. Those who have TRICARE Prime have a primary care manager who coordinates care, and referrals are usually required to see specialists. Prime generally has lower out-of-pocket cost but less provider flexibility. TRICARE Select is more generous. Referrals are not usually required, and enrollees may see any authorized provider. Costs are typically higher than Prime. TRICARE for Life is available to military retirees and their spouses when they become Medicare eligible. It works with Medicare to cover many out-of-pocket costs, such as deductibles and coinsurance. Enrollment in TRICARE for Life is automatic for those who have Medicare Parts A and B, but Medicare Part B premiums are required. TRICARE Young Adult allows eligible adult children, generally ages 21 to 26, to purchase coverage after aging out of regular dependent coverage. Monthly premiums apply, and plan options mirror Prime or Select. Some plans are designed for specific groups. TRICARE Reserve Select and TRICARE Retired Reserve are for members or retired members of the National Guard and Reserve. These plans require enrollment and monthly premiums, and cost sharing applies when care is received. For those enrolled in TRICARE, coverage and costs can change when a service member retires, leaves active duty, or becomes eligible for Medicare. The VA system is operated by the U.S. Department of Veterans Affairs. It is a nationwide healthcare program for eligible veterans. Unlike private health insurance, the VA is an integrated healthcare delivery system. Veterans enroll and receive care at VA medical centers and clinics, or, in some cases, through approved community providers. Instead of choosing between plan types, veterans apply, are assigned to a priority group, and receive care based on eligibility and service history. Eligibility depends on military service, disability status, income, and other factors. Some veterans pay no premiums or copays. Others may pay copays for certain services or prescriptions. Enrollment is required, and not all veterans are automatically enrolled. The VA also administers CHAMPVA, a health coverage program for certain spouses, surviving spouses, and children of veterans. Eligibility for CHAMPVA is limited to individuals who are not eligible for TRICARE and who meet specific criteria. This includes spouses or dependent children of veterans who have been rated permanently and totally disabled from a service-connected disability, as well as surviving spouses or dependent children of veterans who died from a service-connected disability or who were rated permanently and totally disabled at the time of death. In some cases, spouses or dependents of those who died in the line of duty may also qualify. CHAMPVA is a health coverage program, not a VA facility-based system. Eligible family members may receive care from civilian providers. Cost sharing, deductibles, and enrollment requirements apply. Those who become eligible for Medicare must enroll in Medicare Part B to maintain CHAMPVA coverage. Some individuals qualify for more than one type of coverage. When this happens, coordination rules determine which program pays first and how costs are shared. For those with Medicare and TRICARE, Medicare usually pays first and TRICARE pays second, leaving little or no out-of-pocket cost for covered services. Enrollment in Medicare Part B is required to keep TRICARE for life. VA coverage coordinates differently with Medicare. VA coverage generally pays for care within the VA system, while Medicare pays for care outside of it. Some veterans and retirees also have employer-sponsored insurance. Which coverage program pays first depends on employment status, age, and whether the person is retired from the military. Having more than one type of coverage does not eliminate all cost. Each program has its own enrollment rules, provider networks, referral requirements, and cost-sharing structure. Using the wrong provider, missing an enrollment deadline, or not enrolling in required programs such as Medicare Part B can result in unexpected bills. Eligibility can also change over time. Retirement, relocation, disability, or aging into Medicare may affect coverage. Military and veterans health care coverage can offer access to medical care and strong protection from healthcare costs, but it is not always simple. The type of coverage available, how it works, and what it costs can change over time. Knowing how the programs work can help reduce gaps in coverage and lower cost.